People here at Georgia Tech call me Dr. J, and that's because Jiten's a hard name to pronounce. I got my MD from St. John's Medical College in Bangalore, and after that I got a master's in human-computer interaction here at Georgia Tech. So HCI, or human-computer interaction as I like to define it, is a branch of computer science that has psychology into the picture. So it's all about designing and developing like user-centered tools and tools that put the user before the technology. And I've actually used that knowledge and applied it to healthcare. I've also founded Usable Health as a result of the research that I've done here during the master's program. Unusable health information is exactly what it sounds like, but if I had to define it, I would say it's healthcare advice that's medically sound, like it's medically consistent, but there's evidence that nobody's following it, and unfortunately there's tons of it out there. Like for example, I've been researching the My Food Pyramid guidelines, which is basically a method to apply the concept of required dietary allowances into real life settings. All of us are taught the My Food Pyramid about the different food groups and how much of each food group we're supposed to consume. And I've been researching it for 3 years, and I find it hard as a medical professional to integrate it into my lifestyle. I think that's a problem. I think that's definitely a big problem, that if medical organizations are spending so much time coming up with this wonderful research and that's not actually trickling down into people's daily lives, there's a lot of time, energy, and resources that are being wasted, and that's exactly what I want to fix with Usable Health. Usable Health is a company that develops technology which converts evidence-based guidelines into real-life recommendations. The guidelines, clearly suggest that there are certain targets for daily values for a variety of nutrients that I'm supposed to hit at the end of my day in order to, achieve my health goal, or in order to, live a healthy life. Like, there's so much math and information behind like trying to eat healthy that is not apparent, at the surface. When you go to a restaurant, you look at a menu and you have like 5 minutes to actually make a decision, at the point of ordering the food item. And obviously it's impossible, it's physically and humanly impossible to go ahead and do all that math and come up with the best possible choice. Usable Health is exactly that platform. It's the platform that would plug in the results of that research and would help me go to the restaurant around the corner and order from a menu. So it's basically bridging the gap of converting unusable information into usable real life suggestions, and that's what the technology does. Right now, the standard for health seeking, using the internet is basically to reach a health aggregator like WebMD or the CDC website that has, again, great resources, a lot of good material out there. But I don't think that that's what's going to change behavior. Like, if I tell somebody to go and read 10 articles on how to lose weight, I can almost be sure, I'm actually sure based on the work that I've done, that I'm setting myself up for failure. And I think it's pretty sad that, again, from a healthcare provider standpoint, if I'm spending 10 years in medical school and if I'm, learning all these great things to help people, and then I'm giving out advice that has a high probability of not being followed, I think that's a huge problem. At the end of the day, I want people to be healthy. And at the end of the day, I want to make sure that, all my efforts are not being thrown in the trash can outside my office, because there's no body of work to facilitate that specific interaction.